Hi, and here we are in our largest skills lab, and we kind of call this one the main skills lab or the big skills lab. This is room C12. This is the room that you will learn how to wash your hands, make a bed, how to take vital signs, that's someone's blood pressure, temperature, respirations, how to change a dressing, how to insert a catheter so that they are able to use the bathroom. And this is also the room that you will use in the course of assessment where you learned about SAM earlier, whenever you listened, or maybe later. Depends on how Mrs. Moore puts the videos together. The class where you learn the basic skills is during the first semester in the nursing program, along with the pharmacology. And you spend about 8 weeks in this lab learning those skills, and then you will have a clinical in a nursing home or assisted living facility. So you will have videos to watch, demonstrations of the skills, and then you'll have time to practice the skills and then demonstrate them back to your instructor, usually the week after that. Okay, we have 12 beds in this room so that students are able to have 1 or 2 people to a bed to practice the skills. This semester with COVID, we are being a little bit more particular about students working with the same pair, same person, or maybe even individually working at the bedside. And you can see we also have these tables marked off so we don't have as many people able to sit there. Some sit at the table, some sit back at the bedside with the mannequins. We do have a mannequin at each bedside here so that you can practice many of the skills on them. They don't talk a whole lot, they don't complain a whole lot, so that's kind of good when you're first learning skills, maybe if you're nervous. We have the same head walls in this unit, so there are options for you to practice all of those skills at each bedside. We do have the computer charting system that students can use. You can also, if there's a video that you need to relook at, you could do that from that computer. We have a teaching station here, so you might have a little bit, not really lecture, but explaining the skills or the things you're going to be doing in lab that day. The faculty person would do that. We also have models that we have out so you can refresh what anatomy and physiology look like, or if you're learning about particular body systems or diseases, we try to have models that demonstrate those kinds of things. So this is our big lab, all right? And because of all the models and things that we have, we're very lucky in this building that we have a nice large storage area. In our older building, we had all of these things in different closets, different areas, different parts of the building. And here we have everything all together so that we can do laundry. We can have the models, they're kind of in order by the course so that faculty can find things. If there's something that we didn't get out, they're able to find those, get them out so that you can see. As you move along in the program, if you had some kind of presentation to do for a course, you're welcome to check out these models or pieces of equipment within reason, as long as they're not being used at that particular time, so that you could use them as a visual aid, say for a speech or a teaching session you were maybe doing for a requirement for a sorority, another group, another nursing class. We just have lots and lots of simulated things, models, equipment that you can use. This is kind of our hub for where faculty can pick up the equipment they need, and we have it ready for them for class. We have vital sign machines, so that, and you may have seen these at doctor's offices, in hospitals. There are different kinds, so we try to have different kinds of equipment so that you're not just learning about one model or one brand. We have IV pumps, we have PCA pumps where medication can be administered. Actually, the patient can control that. It gives you a sense more of a feeling of control, and it's set so you can't overdose yourself, but you can control that and get medicine and not necessarily have to wait on the nurse if things are very, very busy. We have regular IV poles that we hang IVs from. We have some bags there that sometimes when they're trying to infuse fluids in a hurry, you can actually pump those up and apply pressure. It helps push the fluid in, okay? We have a lockable case If sometimes, perhaps on pediatric units or maybe other units where patients or family members sometimes try to mess with IVs or pumps and change them, you can actually lock the stuff up in there. We have a wound vac. This is a machine that helps apply suction actually to a wound with special dressings on them so that it helps a patient heal. That's not just your everyday wound, but usually if they're more severe and they take more serious interaction, okay? We have some of the older IV pumps. This is the one you're looking at right now is similar to the ones we had in the pharmacology room. It's just an older model, and there are still agencies that have those. And then we have 3 other pumps right here that are a different brand. Those I know at one point at least were used at the IU Health Methodist agencies. They are called an LRC brand. They have different modules where you can also do the same thing, the PCA pump, where you can administer medication. We have wheelchairs and mobility equipment so that students learn how to transfer patients, how to help them move and protect their own back and their own body from not lifting someone who's too heavy and hurting your back. And then we have a couple of pumps here that are for tube feedings. If the person has a tube into their stomach or perhaps through their nose into their stomach, we can administer liquid feedings through these pumps so that they're still getting their nutrition if they're not able to eat for whatever reason. There are a variety of reasons people might not be able to eat food. Okay, and we have a collection of stethoscopes. We have, when you're learning about vital signs, about taking blood pressure, listening to lung sounds, we have stethoscopes that have 2 sets of earplugs on them so that you and a classmate or you and an instructor could listen, and so that the instructor knows that you're hearing the right sounds, so that you can tell, they would know then that you're hearing the right numbers for the blood pressure. Okay, so I could put these in my ears, you could put those in your ears, and we both listen to the same thing. We also have several otoscopes. Those are and audioscopes, equipment that you can look at ears and eyes to see how they're working. You'll learn how to use all of those generally in the assessment class or maybe even the pediatric nursing class. And again, we have that equipment that you can check out. Once you're learning those skills, you'll be able to check those out if you want to practice at home, in the dorm, to learn how to use them and practice. It's always a good thing to take a blood pressure on as many people as you can, then you learn how to interpret and hear the sounds. Some people's blood pressures you can hear easier than others, and you want to be able to hear all that you can. We have a cart usually for each course. It has the supplies and the equipment on it that the faculty will need for you to do whatever the skills are. So you see we have the cart there for pharmacology and one for assessment. And then we also have some models on the other carts as they're getting ready to use those in class. We have several posters, and then there are general supplies there so that faculty can get things. If we've not gotten it on the cart or they need an extra one, they're able to get a hold of those. Okay, thank you very much. I look forward to seeing you all in the nursing program at some point.